Um, can I start? Okay. Assalamu alaikum. My name is Zulia Shakir. I'm a registered physiotherapist in Ontario, Mississauga. Here in Canada, I have more than 3 years of experience as a registered physiotherapist. My education background is that I have done my bachelor's of physiotherapy and master's of physiotherapy from back home in Pakistan. So here I'm working as a registered physiotherapist now. My other skills are I treat females with pelvic physiotherapy. I also treat vestibular rehabilitation and TMJ joint pain. Today I'm representing Achieve Physiotherapy as I work there. So today my topic of presentation is back pain and how to prevent it. So me and another physiotherapist, Wajiha, will divide the presentation, teach you about the topics like what are the causes of the back pain and how we can prevent it. Because in my clinical expertise, I see a lot of people, they come with different kind of back pain. So it is very important for you to find out what are the causes of back pain and why it happens and what we can do to prevent it. If you have any questions, concern, you can please ask me anytime. So let's start the presentation. So the back problems are the most frequent cause of activity limitation in adult and senior population, and also in the childhood as well, because they play a lot of sports, right? It has a broad range of potential causes for both adult and senior population because of a lot of causes. Today we will be discussing some of the causes too. Okay. The causes of the lower back pain are sprain strain, mechanical lower back pain. I will be explaining all of these pains, okay? Disc herniation, sciatica, very common. Then piriformis syndrome, it is also very common. Stenosis, spinal compression fracture, arthritis, and we will be also discussing postural dysfunction. Okay. Let's start with the sprain and strain. So what is a sprain and strain? A strain means it's just an injury to a muscle or tendon. Tendon means what happens in our joint, the muscle never connects the joint directly. It has a tendon in between. If there is an injury to the tendon, it is called a strain. Then we have the ligaments that join different joints of the body together, that is called ligament. If there is a ligamentous injury, which is called a sprain. If somebody has a strain, just a muscle tear, it can heal up to 4 to 6 weeks. But if somebody has a sprain, that is a ligamentous tear, it takes more time to heal. So now the causes of sprain and strain. Some very common causes are that in everyday life we do repetitive forceful movements. Sometimes we do lifting, repetitive lifting, and the common mistake we do is when we lift from the floor, we lift in a wrong way. So there are certain techniques that we can use to lift in a proper way. That Vajia will be discussing after. So how to lift from the floor to the waist level, and if you are carrying any weight, what is the proper position to carry that weight and turn to the side. That we usually do mistakes in our daily life that causes sprain and strain in our joints. Okay. Now, our back can easily injure, for example, playing high impact sports like football, or if somebody has a car accident. Then in our daily life or even at workplace, we do repetitive bending, we do repetitive heavy lifting in a wrong way again, we do repetitive twisting that causes a strain from heavy lifting, lifting from the ground, or an item that we have to put overhead and repetitively. So that are the common causes of lower back strain. The other very common cause of lower back strain is the poor posture. Like sometimes we are sitting in a slouch posture. It causes a lot of stress on your spine. And when we are sitting for prolonged times, prolonged hours sitting causes more stress on your spine than standing because it compresses your joint. That also causes a sprain and strain on your joint, and the surrounding muscles also cause we always ignore, and maybe some people are not aware of. Like we have the abdominal muscles at the front, but those abdominal muscles play very important role in support of your spine. These are called core muscles that we always ignore to strengthen. Okay? At the end, we might teach you how to strengthen the core muscles as well, but always do the exercises after seeing your physiotherapist or the doctor, because every individual is different, okay? Now, people who rarely exercise are also prone to sprain strain. The reason, because if you don't do exercises, our muscles are already weak and they are very prone to injury. Okay, now the treatment and prevention. A sprain strain, like I said, if it is a strain, like only the muscle injury, it may heal to 4 to 6 weeks, right? But if it just happened, like it is called acute, for 2 weeks to 3 weeks, a sprain strain, if it just happened, you just pull your muscle. That is the acute condition. So in acute condition, you need to rest and ice. Just ice it, rest. You can do compression. You can take pain medication prescribed by your doctor. You can avoid activities like repetitive lifting, repetitive pushing and pulling, or the activity that caused the strain. You simply have to avoid that for a few weeks. Then you have to take, when you are able to take, physical therapy and exercises, and gradual return to your work. I mentioned you can do ice. A lot of people do ice, they just put ice pack on the skin. Please don't do that. Put the ice pack in a towel and then put on your skin, because people come with ice burn, right? So you have to always cover the ice pack before you put on your skin. Okay. Now the next comes mechanical low back pain. This is a very common term. Wherever you go, oh, you have a mechanical lower back pain. So what is that mechanical lower back pain? How does it comes? Okay. So mechanical back pain is a general term that refers to any type of pain that is caused by placing abnormal stress and strain on the muscles of the vertebral column. Like common causes are joint disease, any joint disease, arthritis, any herniated disc, any fracture or myofascial pain can put a lot of stress on your spine. That causes mechanical lower back pain. It can also occur from a trauma, such as a fall or a car accident, or it just happened over the period of time. Repetitive spinal movements, exercises incorrectly, or postural sitting, poor sitting habits are some examples that can lead to development of the mechanical lower back pain. Now I will discuss the very common problem that people come with, and they come in the clinic and they say, oh, I have a disc herniation and that is why I have pain. So let's